Okay, so we are ending the poll question now. Thank you so much, everyone, for sharing your answers. We have received one response each for options 5, 10, and 3. Let's see what's the right answer for this. The question was, how many types of hepatitis viruses are there? So in today's webinar, Dr. Dolly would be making us understand about the types of hepatitis viruses that are present. So we have ended the poll now, and we would now be starting with our webinar. Thank you so much, everyone, for joining in. In case you have any questions during the webinar today, you can start sharing those. You can start posting those in the chat box section. Also, if you have anything that you wanted to discuss, any issue, you can surely share it in the chat box section, and we would be taking up your questions towards the end of the session today. So, namaste, Sat Sri Akal, Salamu Alaikum, and a very fresh good evening, everyone. This is Sanghamitra, leading the care management team at Xyla Health, and I'm your host for the evening today. So, to start with, and for a quick introduction, Xyla Health is India's leading AI-powered health management platform that is serving 5 lakh plus patients in 595 plus cities and happens to be the highest rated app with a 4.8 plus rating and delivers 24/7 care. We have been helping people with multiple health conditions such as COVID, diabetes, heart issues, kidney health issues, and women's health issues through a very able and experienced team that is in-house at Xyla for the highest quality care. So tomorrow is World Hepatitis Day, which is celebrated or which is observed to raise the awareness about hepatitis. And we are here today to understand in detail about the various types of hepatitis, its vaccines, and steps to prevent it. For this, we have with us our expert, Dr. Dolly Bagai, who happens to have 3+ decades of experience in this field and specializes in family medicine. Dr. Dolly has been previously associated with Safdarjung Hospital, Delhi as well. So we are very delighted to have you amongst us today, Dr. Dolly, and looking forward to this informative session with you. Over to you now.
So a very warm welcome and a very good evening to everybody from Xyla Healthcare and my co-host Sanghamitra. And I welcome you all to this very important seminar on hepatitis, who is prone, vaccines, and something more to it. So we are hosting this webinar today because liver is a very important organ and we need to save it. We have only one liver in the body, and we, at any cost, we need to save it till the end of our lives. And therefore, we have to become aware of the various injuries that are inflicted onto the liver by various means. Why are we talking about hepatitis today? Is because it is a preventable disease and very good vaccines are available to prevent liver from getting inflamed, which is what we call as hepatitis. Secondly, I also want to emphasize that very good treatment is available now. Not only treatment, but very good non-invasive testing modality in the form of fibroscan is now available to scan the liver and plan the future ahead for the patient. Now, we don't need to go for invasive techniques like liver biopsy, but we have very much more advanced ultrasounds, 3D ultrasounds, 4D ultrasounds, fibroscan to understand liver and its diseases. So let's go along. I'll be talking about hepatitis, its various forms, and why hepatitis occurs due to various injuries. As I mentioned earlier, liver is a very important organ. It is unique. Why is it unique? Because it has a dual blood supply. It has an oxygen-rich hepatic artery, which is supplying all the good material, all the oxygen and the good sources of minerals to the liver. And it has a hepatic portal vein, which is draining away all the toxic waste from the liver. It filters the waste products and stores fat and produces proteins and bile, which helps in breakdown of fats and its digestion. Liver also produces a very important vitamin in the name of vitamin K, And liver also breaks down the toxic substance called ammonia in the body, thereby helping in its excretion. Next slide, please, Sangha. Sangha, can I have the next slide? So again, I'm repeating, the inflammation of the liver is called hepatitis. And as you can see in the diagram, blood arrives into the liver through the two sources, the hepatic artery and the hepatic portal vein. You can see the diagram that the hepatic portal vein is carrying blood containing digested food from the intestines to the liver and storage ke liye hai ye. But the hepatic artery is bringing oxygen to the liver so that it can perform its functions. And when there is inflammation, there are high ammonia levels because liver is not functioning, and therefore it is not able to break down the ammonia and it builds up in the blood. Bilirubin, again a waste product which is excreted by the liver, builds up in the skin and the eyes because excretion is hampered, and hepatitis occurs majorly by various drugs, be it allopathic, be it Ayurvedic, be it herbal. Many preparations cause insult and injury to the liver. Medication, most commonly used anti-tubercular drugs, most commonly used statins, and most commonly used anti-epileptic drugs also cause liver injuries if their levels are not measured by the treating doctor. And inflammation of the liver also occurs because of excessive alcohol abuse, excessive alcohol intake, and liver also gets inflamed by infection through viruses. There are also many other causes of inflammation of the liver. For example, amoebic liver abscess, bacterial infections. But today we are going to be talking about hepatitis, the various forms of hepatitis which are viral in origin, as they are named to be viral hepatitis. So today we will be talking about the various forms of viral hepatitis caused by the various viruses which I will be speaking about in the next slides. Can I have the next slide, please, Sangha?
Yes. Also, Dr. Dolly, sorry to interrupt. Do you wish to play this video now in which we are showing function of liver?
Yes, please go.
Sure. I'll just play it for the audience so that they can have a look. Just let me know when it is visible, Dr. Dolly.
Ji.
On the right side of your abdomen,
See, these are the various functions of the liver. And this is how the liver sends its blood supply. And these are the red blood cells. Again, abuses. Sugars, proteins. So Sangha, we'll now move on to the next slide, please. This is the damaged liver, the diseased liver. The color has changed. It may be shrunken, hard, or swollen. Sangha, please play the next slide.
Yes, Dr. Dolly, I'm just bringing up my screen.
Okay, no problem. So now I'll be talking mainly on viral hepatitis. And as we asked in the poll, there are 5 main viral hepatitis, 5 main types of viral hepatitis. The correct answer is 5. Now we shall be talking about these 5 main types, and this will go alphabetically: A, B, C, D, and E. The full names are HAV, HBV, HCV, HDV, and lastly HEV. But in short, they are named as A, B, C, D, and E. Now let us see one by one what each hepatitis is all about. Now let's start with hepatitis A. Hepatitis A, as you must have all been aware, is coming from contaminated food and sewage water. When there is a mix of sewage water in the drinking water, as occurs during monsoons, or when there is a leakage from the rusted pipes of sewage into drinking water, the disease that we get is hepatitis A. And in nature, it is only acute. Acute meaning short-lived, because the immune system flushes it out and there is a major ability to spread. It is very highly contagious. 2 weeks before the diagnosis and 3 weeks after infection. Now, how is it contagious? We are passing the same virus in the stool, and it is contagious through, again, contamination of this sewage water into our drinking water. What are the signs and symptoms of hepatitis A? As you understand, whenever liver gets diseased, there is always nausea, vomiting, and since the liver is the seat of appetite, there is loss of appetite, and the patient may get fever with chills. There's a lot of fatigue, listlessness, dark urine, because bilirubin is coming into the urine, clay-colored stool, whitening, because the normal brown color of the stool gets gradually light-colored and becomes clay-colored. There may be joint pain in some patients. And how will you diagnose hepatitis A? By using liver function test and viral marker, which is said as anti-HAV. These are viral markers which tell us or pinpoint which virus has affected the liver. What is the treatment of hepatitis A? The treatment of hepatitis A is mainly supportive, because as I mentioned above, that it is an acute disease. The immune system is going to flush it out. So we use supportive treatment in the form of high carb diet. Sorry, there is a printing mistake. There is a high carb diet, presence of lot of oral fluids. In India, we use a lot of ganne ka juice because it is very rich in carbs, and bed rest, and most importantly, isolation. If after 2 weeks jaundice is worsening or the liver function is worsening, patient is getting sicker, then we use the immunoglobulin. But immunoglobulin is not the first line of treatment. It is only post 2 weeks if jaundice worsens. And it is a preventable disease. Here lies the emphasis. The vaccine against hepatitis A prevents severe infection from hepatitis A. It is given in 2 doses at 6 months apart, 0 and 6. And most importantly, you have to practice very safe hand hygiene post-exposure and proper sewage disposal. These are very important modes of prevention of hepatitis A. So now let's go to hepatitis B. Hepatitis B is not waterborne. It is caused by body and blood fluids, sexual exposure from infected person. It is seen in IV drug abuse and during birthing. When a hepatitis B infected mother gives rise to an infected infant. Why? Because there is a cross-placental transmission of this virus. And here lies the difference. It is not acute, but it is both acute and chronic. It may lie dormant in the body for years to come, and it may show up when there is a trigger or an abuse. How is it contagious? It is contagious by sexual exposure, by getting transfused blood, which is infected with hepatitis B, and by body fluids like saliva, like urine, like semen. Semen is also transmitting hepatitis B. What are the signs and symptoms of hepatitis B? Again, the same, because liver is at disease now. It is nausea, vomiting, loss of appetite, fever with chills, fatigue, dark urine, clay-colored stool, and sometimes joint pain. Now, how do we diagnose hepatitis B? Again, by doing the liver function test, and the most important part is the hepatitis B surface antigen. And once your hepatitis B surface antigen, in short, we call it to be HBASG, is positive, then the doctor advises to go for viral load to see. As in HIV patient, we get the CD4 count. Similarly, in hepatitis B patient also, we get a viral load count to see what is the load of the virus in the body and who is at risk for transmission for hepatitis B. It is very, very high in infants. It passes through the mother, through the placenta. It crosses the placenta. This virus is notorious because it crosses the placenta. So what do? We advise all mothers, I am saying again and again, A, capital, L, capital, L, capital, all mothers to get their hepatitis B status and to tell their doctor in case their surface antigen is positive, because we need to prevent transmission to the neonate or to the infant. And what are the complications? The complications are much more than hepatitis A. Why is it so? Why are the complications more? Because it is not only an acute disease, it has a chronicity. It stays in the body lifelong, and patient can become chronic and lead to cirrhosis of the liver and hepatocellular carcinoma. What is the treatment? In the initial phase, the treatment is supportive. But now, once the initial phase is over, we are giving very good antiviral drugs and immunoglobulin. Previously, interferon used to be used, but now, since the advent of new antiviral drugs, interferon has been discontinued and very, very effective new and less toxic antiviral drugs are available to treat hepatitis B. What is the prevention? This is the most important point, the vaccine, hepatitis B vaccine. It is to be given to now in the National Immunization Program. Hepatitis B vaccine has been included, and it is the first dose is given at birth. Such is the program now. At birth, then at 1, 2, and 6 months. So we are giving 4 doses to infants. But if you are an adult and you have not had a vaccine, then we give 3 doses of vaccine, 0, 1, and 6. But in case of pregnant women, a test is must before conception. That is what I am saying, because hepatitis B is transmitted through the placenta to the newborn. and very good preventive strategies are available. So I request everybody to get their hepatitis B surface antigen done. And if it is positive, then to go for a viral load so that it can be treated and complications of hepatitis B, such as chronic liver disease, cirrhosis of the liver, and hepatocellular carcinoma, can be prevented. It is a preventable disease now, and it is a curative disease now. Only awareness is not there. I am requesting everybody to be aware of their hepatitis B status. Let's go to the third one, the hepatitis C vaccine. Hepatitis C virus. Hepatitis C virus. It is similar to hepatitis B. It is caused again the same way of transmission by blood and body fluids, by sexual exposure from an infected person. It is mostly seen in IV drug abusers and those who are using sharps and used needles. They are very, very prone to hepatitis C and especially on long-term dialysis. Therefore, because in dialysis, blood and blood products are used, and patients on long-term dialysis are also very prone to hepatitis C. Same as hepatitis B. The nature is acute as well as chronic, and there is ability to spread. It is contagious. Same way through blood and body fluids. What are the signs and symptoms? The signs and symptoms in all liver diseases are practically the same. Nausea, vomiting, loss of appetite, fever with chills, fatigue, dark urine, clay-colored stool, and joint pain. How do you diagnose hepatitis C? You diagnose hepatitis C by using the same methodology, liver function test, hepatitis C markers, and viral load. What is the risk? The risk is high in partners of drug abusers, multiple sexual partners, and long-term dialysis patients. These are the ones who are extremely at high risk to acquire hepatitis C. And what are the complications? Complications are similar, can become chronic and lead to cirrhosis of the liver and hepatocellular carcinoma. The treatment again is antivirals. But here comes a word of caution. There is no vaccine, there is no immunoglobulin. So the only thing that you can do is to prevent yourself from getting hepatitis C. And if you get infected with hepatitis C, then you need to use antivirals because there is no vaccine to prevent you from hepatitis C. You need to practice safe practices, safe sexual behavior, and you need to be very careful if you are on dialysis. The fourth one, hepatitis D. It is again similar, and it is again spread by blood and body fluids, sexual exposure, drug abuse, sharps, and it has the same course, acute and chronic. It is contagious. The signs and symptoms are the same. The diagnosis is by using liver function test and hepatitis D markers. The risk is high in partners of drug abusers, multiple sexual partners, dialysis patients. Same, absolutely same. Can become chronic, lead to cirrhosis and hepatocellular carcinoma. The treatment is with antivirals. But the prevention here has some cross immunity. So it is because the vaccine against hepatitis B gives you cross immunity against hepatitis D. So my humble request is to everybody to know their hepatitis B status and to get vaccinated for hepatitis B if your status is negative and if your antibodies are low. Please get yourselves vaccinated against hepatitis B. I am emphasizing this because it is a preventable disease. Many complications can be prevented by a simple 3-dose regimen vaccination, which is easily available and now also a part of the National Immunization Program. The last but not the least is hepatitis E. Sangha, can we have hepatitis E slide? Now, hepatitis E behaves similar to hepatitis A. It is again through contaminated food and water, undercooked meat, more common in underdeveloped and developing countries. It is very common in India because the quality of meat is not regulated. So you might get hepatitis E through contaminated meat and undercooked meat. If you're not cooking it well, there is a chance of transmission. The nature again, similar to hepatitis A, it is acute and it has an ability to spread, contagious, again, through contaminated food, water, and undercooked meat. The signs and symptoms are the same again: nausea, vomiting, loss of appetite, fever with chills, fatigue, dark urine, clay-colored stool, and sometimes joint pain. How do you diagnose hepatitis E? Same way, liver function test and hepatitis E markers. The risk is very, very high if you get hepatitis E in third trimester of pregnancy. The treatment is supportive along with bed rest. Supportive meaning high carb diet, plenty of oral fluids, drugs to control your nausea and vomiting, and you have to wait till your immune system flushes the virus out. Again, a word of caution: there is no prevention except by vaccine or immunoglobulin. Therefore, you need to prevent it through safe hygiene, hand washing, cooking well, keeping your sewage and your toilet water disposal in a safe way. So these are the only ways that you can prevent hepatitis E. And hepatitis E outbreaks are notorious during the monsoon seasons. So please take care of your hygiene practices. The most important points to ponder. Can we have the next slide, please, Sangam? So now what are we talking about? We are talking about damage to the liver or hepatitis in its various forms. So as you have understood, there are two important modes of transmission. One is the contaminated food and water, contaminated sewage water, and the other most important is blood and body fluids, unsafe, unhygienic sexual practices. So why don't we think about these points? If there is sewage water contamination, beware of hepatitis A or E. Vaccine is available for hepatitis A. So please get vaccinated. 2 doses, 6 months apart. Now another vaccine, a new vaccine has come, Twinrix, which is a mix of hepatitis A and hepatitis B. So these are again 2 doses, 6 months apart. Easily available and highly effective vaccine. Kindly go for it. Think of hepatitis B and D together. They are transmitted similarly. Hepatitis B's vaccine is available and it also gives you cross immunity against hepatitis D. So please get yourself vaccinated by the hepatitis B vaccine. And adults can get another extra dose to boost their immunity. And people who have chronic kidney disease, they need a double dose of hepatitis B. That is, instead of 1 ml, we give 2 ml, 3 doses. So exactly the double. Why? Because we wish to prevent hepatitis B and hepatitis C during long-term dialysis. Sangha, can I have the next slide, please? Now, I have talked a lot about hepatitis, its 5 various types. And I have also talked about the modes of transmission and how you can prevent it and how you can cure it. Now we need to talk about interpreting lab results. The most important lab results that are done to see for liver disease are LFT, that is liver function tests, the viral markers, which tells us which virus has got us. And an ultrasound of the whole abdomen. We need some special tests also, wherein we do blood ammonia and we do the prothrombin time, which we as doctors say PT-INR, to see if there is any deficiency of vitamin K occurring so that we can give the injection of vitamin K. And if the patient is going to into a coagulopathy. So we are doing these tests, and do not delay the testing. If your doctor has prescribed the test, always get your self-tested from an authorized lab. I repeat, authorized lab, because most of the labs do not have a standard technique of conducting these tests, and we may get wrong lab results and we land up in a mess. Because as it is, when we get hepatitis, we get extremely worried and we get extremely tense. And if the lab results are worsening, it is even a cause of concern, more concern than usual. So therefore, please get yourself tested from an authorized lab, a standardized lab, so that there is no confusion as far as interpretation of these lab results is concerned. Coming to the phases of viral hepatitis, many people worry, अरे मेरा तो LFT बुरा हो रहा है, my lab tests are worsening, doctor, what will happen to me, how will it go, how will the disease progress, how will I get okay? So therefore it is here that we explain the phases of viral hepatitis. As you understand, there is a pre-ectric phase. Pre-ectric meaning before the onset of jaundice. There is an increase. Ecteric is jaundice. So pre-ecteric is when you have some symptoms we call as syndromal symptoms, but jaundice has not yet appeared. And in this phase, there is increase in body symptoms like joint pain, fatigue, nausea, vomiting, abdominal pain, retching. You do not feel like eating anything. There is increasing liver enzymes, increasing bilirubin. Things are going on the on the log. If you plot it, the curve is going upwards. The icteric phase, that is when jaundice sets in. Icteric means jaundice or the yellowness sets in. There is some decrease in the body symptoms. The jaundice now is setting in. There is dark urine. There is clay-colored stool. There is enlarged liver with pain. And your liver function tests are worsening. Your viral load is increasing. You are ascending the graph of hepatitis. And it is at this point the worry starts that jaundice is getting worse, liver function is getting worse, symptoms are getting worse, anxiety is getting worse. After 2 weeks, the post-icteric, meaning the post-jaundice convalescence phase sets in. Jaundice and dark urine start subsiding. Now you are descending the curve. Jaundice starts decreasing. Dark urine starts decreasing. Stool starts regaining color. Appetite starts increasing. Nausea, vomiting start reducing. Liver enzymes start settling down. Bilirubin starts to decrease, and everyone is happy. And this is a phase which lasts for another 2 weeks. That means the worst is over, the storm is over, and now the liver is on way to recovery. What are the actions to manage hepatitis? The next slide, please. What are the actions to manage hepatitis? How will we manage hepatitis? Sangha, can I have the next slide, please?
Yes, that is already presented, Dr. Ollie. I hope you are able.
I am unable to see, Sangha. I can speak, but. So let me continue. I will be now talking about a mnemonic. Hepatitis, Hepatitis, that is hepatitis. So let us see what hepatitis syndromic says. H is for hand washing and hygiene. E is for eat a low fat diet, a high carb diet to help liver regenerate. P is for personal hygiene products, not to be shared. For example, razors, towels, toothbrushes, drinking cups. Your utensils need to be isolated. A is for activity, which needs to be conserved. You need to be on bed rest for recouping. T is for toxic substances that need to be avoided if you are having jaundice in the form of alcohol, drugs, aspirin, painkiller, over-the-counter medications. I, very, very important, individual bathroom to be used when you are infected with hepatitis A or E, when you are sick, so that there is proper sewage disposal and the next person in the household is not infected. T is for test at the appropriate time. Get your lab tests done at the appropriate time. Follow them up appropriately at the timely intervals suggested by your doctor. Isolate. I is for isolation from family to avoid spread. And S, the last bit, is small frequent meals to be taken to help curb nausea, vomiting, and retching, and feeling sick after eating. I have a few takeaways. I have talked about 5 types of hepatitis: A, B, C, D, and E. Now, my take is if it ends in a vowel, that is A and E, these are 2 vowels. It comes from the vowel. Vowel meaning its spread is from the feco-oral route. So be very, very careful. It is coming from the bowel. You are spreading it in your stool. The virus is being shedded in the stool. So be very, very careful to isolate and to use a separate bathroom for yourself. B and C and D are caused by body and blood and body fluids. So be very careful when blood products are being used, when fluids are being used. You have to be extra careful that these are not contaminated. D always follows B. Always follows B. It's an unknown part of hepatitis B. So get vaccinated against A and B. If you get vaccinated against A and B, you will be saved from hepatitis A, hepatitis B, and hepatitis D. Because for C, no vaccine is available. Because for E, no vaccine is available. So at least you can take care of 3 out of the 5, which is more than 60%. And when you notice any unusual symptom, do consult your doctor before taking any over-the-counter drugs. Over-the-counter drugs are they play a very crucial detrimental role when your liver is diseased, because the chemist does not know that your liver is diseased. He may prescribe you painkillers over the counter because you have fever, nausea, vomiting, joint pain, and these painkillers will worsen your hepatitis B. There are many other drugs. For example, herbal supplements. We are getting to see a lot of steroid abuse. We are getting to see a lot of liver-induced injury on anti-tubercular drugs. Patients who are taking anti-tubercular drugs, especially rifampicin, is notorious to cause liver dysfunction. And people on long-term epileptic drugs, they also land up in lot of liver disease. Liver is to be saved. This is Hepatitis Day. Prevent injury to the liver, prevent alcohol, prevent over-the-counter drugs, prevent any herbal life preparations. If you're taking any Ayurvedic drugs, herbal drugs, any cough mixture, any over-the-counter drug, if you're an alcoholic, inform your doctor. If you're used to taking any other drugs, if you're an IV drug abuser, if you are having unsafe sexual practices, if you are having multiple sexual partners, please confide in your doctor so that he can save you. Why? Because liver is the most important organ in the body and it needs a dignified let's say, a safety protocol. It's very important to save your liver, lest you land up with cirrhosis of the liver, which is irrevocable, irreversible, and chronic liver disease is always, has a downward course. It cannot be treated once you reach the point of no return. So it's always advisable to stay within the boundary of return. And that's my take for today on World Hepatitis Day. Thank you very much for a patient hearing.
Thank you so much, Dr. Dolly, for sharing that information. So sorry, my internet had dropped in between. So we will now be taking up the questions if we have any from the audience. If anyone from the audience has any questions, they can unmute themselves now. You can unmute yourself and ask the question directly from Dr. Dolly. Otherwise, we'll proceed with some few questions that we have from the audience already. If anyone has any question, आपके कोई भी सवाल है, आप अपने आप को unmute करके अपना सवाल पूछ सकते हैं. Okay, so Dr. Ollie, we have few questions from the users already. So we would be taking those up. So the first question is, if we know that how long does acute hepatitis last? Is there any specific time period for that?
Yes, acute hepatitis lasts for 4 to 6 weeks. That is the pre-icteric and the icteric phase together, 6 weeks maximum. If it goes beyond 6 weeks, we need to be careful. And if we need to give immunoglobulins, we do the liver scans, we do the liver function test. If things are worsening, we go for the immunoglobulin therapy.
Thank you so much, Dr. Dolly. Another question that we have got is, which of these hepatitis form can exist for years without any symptoms? Is there any type of hepatitis?
Yes, hepatitis B. It's a silent killer. And we are getting a hepatitis B epidemic. It's only when the government has started screening for hepatitis B, pre-conceptional counseling is done, pre-conceptional screening is done. We have got a lot of hepatitis B mothers, and in other people also, we have seen a lot of hepatitis B lying silent. Why? Because of their good immune system. The disease does not raise its head, but the moment the immunity goes down, their hepatitis B surfaces.
Thank you so much, Dr. Dolly.
Hepatitis B is chronic, it's silent, and it's a killer.
Absolutely, for explaining in detail. Thank you so much. Great. So we have one question from the audience. The question is, a person having hydronephrosis and have hepatitis B, what is the situation of the patient and what he should do on this?
No, he has to get his viral markers done, viral load repeatedly done. And if he has hydronephrosis, the kidney needs to be drained in whatever form. Wherever the obstruction is, the kidney needs to be attended to, and the obstruction needs to be relieved so that his hydronephrosis settles. That is apart from his hepatitis B. Hepatitis B, he needs a constant follow-up. Very good drugs are available to treat hepatitis B as per the viral load. Very good treatment is available to treat hepatitis B. It is practically, the viral load comes under the stipulated limit.
I hope that answers your question. Thank you so much. So moving on to the next one, Dr. Dolly, can we say that hepatitis is curable?
It depends on the type of hepatitis. If it is drug-induced, if it is alcohol-induced, and the alcohol abuse is not very long standing, then yes, it can be. And of course, virus A and E, they are acute infections. But if hepatitis is due to chronic infection, it is due to B or C, then it is not curable. It can only be treated. And very good drugs are available, and patient becomes Hep C is better amenable to treatment than Hep B. and you can cure hepatitis C, but Hep B remains just under control, like thyroid or blood pressure or sugar. It cannot be cured. It's a lifelong infection.
Thank you for explaining that in detail, Dr. Dolly.
Therefore, the talk on hepatitis and vaccine.
Yes, absolutely. So just the last question for today's session before we end it. Dr. Dolly, you talked about liver ailment and how it affects our liver, about the inflammation of liver as well. So are there any lifestyle changes that one should make to keep their liver healthy?
Yes, now we are seeing an epidemic of fatty liver. And we really need to work out, get up, walk, and not go for fatty foods and unhealthy junk foods. We should really avoid it. We are going in for trans fats, that is fried chili potatoes and momos and fries and burgers and pizzas. These somehow land up in causing fatty liver. We should be very careful on safe drinking water, on sewage disposal, and most importantly, safe sex practices. And we should be very careful by sharing, not by, we should not share razors and sharps and toothbrushes. And most importantly, we should be aware of the vaccine that is available, get ourselves vaccinated so that chronic liver disease does not harm us. These are few practices. I often talk about fatty liver. I often talk about safe drinking water, sewage disposal, safe sexual practices, and timely vaccination, timely diagnosis, and timely treatment.
Absolutely. Thank you so much, Dr. Dolly, for making us understand about hepatitis on the occasion of this World Hepatitis Day, which is tomorrow. Through your efforts, through your understanding and practical experience, we were able to, get aware about this more and able to clear our queries, our doubts. I hope everyone was able to make a note of the points as shared by Dr. Dolly, and you would be able to follow those. If you still have any questions unanswered, अगर आपके फिर भी कोई सवाल रह जाते हैं, we would be really happy to help you with those. So please reach out to us. We will surely get it answered by Dr. Dolly and share the right guidance with you. So thank you so much, everyone, for joining the webinar today. Thank you so much, Dr. Dolly, for coming on this platform and making us aware about hepatitis. Thank you so much.
Thank you and good night. On behalf of Xyla Healthcare, I thank you all, and I thank Sangamitra, my co-host, for helping me through this journey. Thank you so much.